we have a procedure that is extremely popular, that makes your face look slimmer, which most people would consider a great thing. It's not as expensive comparatively speaking when you look at other cosmetic surgeries, and recovery is very easy. All you have to do is just to stay on a soft diet and maybe put some ice to your face for a day or two. So why not do this? And this is a big question that we have to answer here. Who would benefit from this procedure and who should definitely not do this at all? Removal of buccal fat pad would not work for these three categories of patients. Number one, those who don't really have much buccal fat pad. So if the lower cheeks look pretty slim already, removing however little fat is there just wouldn't make much of a difference. So somebody would get the surgery but wouldn't have the beneficial effects of it. The second group of people are those with rounder and fuller faces. Just aesthetically, those flat cheeks don't look good on them. And getting rid of the buccal fat pad can actually make things look a little imbalanced, and it's just not gonna give them the kind of look that they're looking for because the rest of the facial structures just don't go along with it. And the third one are people of older demographics, especially people with slimmer faces. And this is the situation when we all losing fat in our faces with age, and if we start removing additional fat on top of it, we are going to be actually aging the face even more. So this is something that we have to give a very serious consideration to and not make somebody look worse by doing this kind of surgery. In addition, you shouldn't really consider just the immediate effects of surgery. You have to look at how your face is going to continue to change over time, because we all aging and things are looking completely different when we are in our 40s than how we looked in our 20s. When somebody gets buccal fat pad removed in their 20s and the cheek look nice and flat, that might be great, but as they continue to age, they develop more and more hollowness in that area, and people oftentimes develop just some extra skin laxity in the area where the fat was before, so this area has to be smoothed out by a facelift. Or oftentimes people develop some indents in the area as they continue to age, and it becomes very noticeable that something was done there in the cheek because they have a line or a groove running there. So another consideration, not just immediate effect, but how it's going to affect you long term. So buccal fat pad removal, is it the greatest procedure of all time, or it's something you have to avoid at all costs? Well, it's actually neither. It works well for some people, doesn't work so well for other people, and you have to keep in mind that trends change. If it's very fashionable now, it can be something that's completely out of fashion tomorrow, but the surgical result will actually stay for the rest of your life. It might look good on somebody in their 20s, not necessarily will be looking just as good when that person is in their 40s and 50s. So all these considerations you should bring up with your trusted plastic surgeon who would have good experience in this procedure, and they would be able to advise you whether this is something that's going to work for you and you're going to be happy with your results, or something that you really should stay away from. I hope you enjoyed this video, guys, and hope it was informative for you. If you have questions about cosmetic surgery, especially cosmetic surgery of the face, please ask those questions below and I'll be happy to answer them.